You have to forgive Nate, he's new, but he's a quick one. It's much better than what I could have did, because I'm usually eating something. All right, so let's go through this. Can someone read this for me? Is it okay? Jason?
Do you want me to just start with the purpose?
Yep. No, just go to the position.
Patient lies supine with the arm to be tested in a start position of 90 degrees shoulder abduction, 10 degrees horizontal extension, and 90 degrees elbow flexion. Therapist position. The therapist stands with a diagonal stance on the side to be tested with the most lateral leg forward and the thigh positioned up against the inferior aspect of the upper arm and the patient's shoulder positioned at 90 degrees abduction. Left hand placement. The therapist lowers the bed. Left hand. The left hand reaches up and under the posterior aspect of the patient's scapula to place the hand across the posterior and superior aspect of the scapula to depress the shoulder girdle.
It's my right hand because I'm doing her right side.
Okay.
So to pull the scapula down, inferior glide of the scapula, if you will.
Left hand. The therapist's other hand is placed across the palmar surface of the patient's right hand and fingers.
I do like that.
Procedure. The therapist passively depresses the patient's scapula with the shoulder 90 degrees abduction and 10 degrees horizontal extension and holds this position as the left hand sequentially 1. Supinates the patient's forearm, 2. Laterally rotates the shoulder, 3. Extends the wrist and fingers, 4. Extends the elbow.
This is where you measure. Feel it. That's usually where you feel it, is in your forearm. That's normal. Okay? Now, you could have a trusty assistant or technician measure the loss of elbow extension where you feel the resistance. And I'd say she's 20 degrees flexion. If your zero is going like that, so about 20 degrees flexion on the left, on the right, sorry. Okay. Then you repeat that on the other side. Okay. Now, if you further wanted to confirm that they had neck stuff going on, or say there wasn't much there, okay, feel a little resistance. Now I want you to bend your ear towards your left shoulder. Your side bending left, not rotating. Does that change your symptoms? They increase. So get back to the middle. So if you're almost a full extension, and it takes side bending or stretching that further, it's not a very big problem. It's a mild problem. This would be one probably they don't have radiculopathy, and they might benefit from some neurodynamic stretching. Okay, either working on the flexibility of their neck, but also looking at is this neurodynamic in nature. Okay, if the person has a big positive test, you're thinking, well, maybe it's just neck tension. Maybe they have a lot of neck tension or elevating the first rib and causing this to happen. Well, then you have them side bend to the side. So bend to the side. Does that feel better? No different. Okay. So if it reduces the symptoms, you're putting the muscles on slack on that side, so it's not muscular. Okay, you've actually taken the strain off of the nerve. So this is now nerve tension. When you stretch away, you're stretching it further. You're slackening up the neck part of the nerve tension. If you wanted to check it, you could also do a leg raise with it. Have someone else lift the leg after you do it, in that position. That's hard to do on yourself, but so do like this and that, and then have someone else do a straight leg raise. Does that change it? Because you're pulling on the cord distally, so now you're stretching the spinal cord, and that's another way to add nerve tension to assess it, to see if there's. And if that's all negative, then they don't. Something else is going on. It's probably not nerve tension. Okay. So you normally have a positive test before you do all the entire circus act. All right, but I would go through, just say, well, does this hurt? Does this hurt? Does this hurt? Progressively stretch that dural irritation if it's negative to make sure that there's no other findings there. And that pretty much clears it. Okay? Want to go through that sequence again? Take your, no, that's okay. So, if you're in this position, you start here, 90 degrees abduction, shoulder position into slight extension, or horizontal abduction, so 10 degrees behind you, okay? Shoulder position first. Okay. Then elbow position with supination. Then external rotation of the shoulder. Wrist extension, and lastly elbow extension. All the while, you're depressing the scapula. Bring that down. Okay. Yes, Nate?
I'm just saying clinically, you may elicit pain with this, or maybe a stretching sensation too, or a burning sensation. So it's not always just pain. So you talked about asking the questions appropriately or where it's at to make sure you're specific when you're asking that question when you're doing it.
Like, where is it? What kind of pain is it? How would you describe the pain and that kind of thing? And then compare that to the other side, both in range of motion and also in symptom reproduction. Oh no, that just feels like a little burning in the elbow, but the other one, it zinged from my neck all the way down to my fingertip. Yes?
When you side bend away, like how she was not fully extended anyways, like, what was that? So, like,
You're
that
just-
puts a stretch on it.
Yeah, you're creating more of a tension just to see if that changes her forearm symptoms anymore.
So if it decreased it, like what would, or if it increased?
If it usually would increase it because you're tractioning the nerve more, you're stretching the nerve tension more if it's nerve tension. Typically, it doesn't decrease it. If it does decrease it, it's not nerve tension. It might actually just be you got compression when you're here, and when you side bend away, it makes you feel better. But typically, that doesn't happen. If you have compression, you have nerve tension. Usually, they go together. So when you do that, you're still going to have more pain.
And you can still do that, like even if they don't get all the way to full extension?
Yeah, oftentimes I'll do just to see how it changes. But typically, yeah, if it's negative, you definitely side bend them away, you know, to check to see if it changes it at all.
Okay.
Okay. All right. Let's practice that.